Hi everyone. So we are going to continue by talking about the bite and the sting. So it's important for us to know the common microbiology of the organisms involved in this bite. We are going to be looking at three major species: that human being, cat bite, dog bite. So the organisms include the Pastorella, particularly in dogs, the Capnosadovagus carnivorous, the Bartonella ensele, particularly in cats, the staph, and the strep. So these are the ones you see in cat and dogs: Pastorella, the Capnosadovagus carnivorous, the Bartonella, the staph, and the strep. In humans, just think about the Staphylococcus, the strep, and Echinella corrodens. Those are the three common organisms in humans. So anybody that um, is involved in a clench fist fight and the person clenches his or her feet and hits the teeth of an individual, you know, and there is a cut. So you have to think about the tendency of staph, strep, or Echinella corrodens inoculating into that wound. So don't forget the organisms. Bartonella for cat scratch, Pastorella for dog. Although both of them can also be transmitted by both cat and dog. Yeah, but I'm just talking about the ones that are common. So for Pastorella, it's more in dogs. Bartonella is more in cat. Although dogs can also transmit Bartonella, cat can also transmit Pastorella. So any bite involving sharp teeth or deep punctured wound, you must not close it by suture. So you don't do a primary intention closure. So what you do is that you clean, debride the wound, and you leave it to heal by secondary intention. So that's what we do for bite involving sharp teeth, that usually result in a deep puncture, or wounds that involve the hands and the feet. So you don't typically close them by primary intention. You just leave them to heal by normal secondary intention and granulation until you grows into them and they heal up over time. So if you want to give antibiotics for any of these wounds, you have to give amoxicillin. So the good thing is we might need, we have learned so many organisms now, but one thing that is good is that all of them respond to one particular antibiotic, and that is amoxicillin. So either human, cat, dogs, just give your amoxicillin, clavulanic acid. It works. And people with this condition, having deep puncture wound, having injury to their hands and feet, having, you know, um, injury involving sharp teeth, particularly from cats, because the teeth of the cat is usually very sharp, and they elicit a single puncture wound. So there's a very high risk of infection, you know, with deep penetration. So you must give your antibiotics and you must monitor for deep tissue infection, particularly the ones involving the bones like osteomyelitis. So don't forget, deep puncture wound, you know, particularly involving the sharp teeth, those ones involving the hands and the feet, you don't close by primary intention. Do not forget. And you must always give antibiotic cover. So let's look at rabies algorithm, because our step two is more entirely about, you know, diagnosis, treatment, fine, but we are also going to talk more screening, prophylaxis, treatment. Very important. So um, we have an animal bite. We need to first separate: is it a wild animal or domestic animal? So anything outside cat and dog is wild. So pet, cat, and dog, they are domestic, but bats, skunks, raccoons, those ones, they are wild animals. So let's focus on the domestic animals. So somebody gets beaten by a domestic dog or cat. So we want to make sure we reduce the chance of the person developing rabies. So what do? We ask the owner of the dog or the cat, is your dog vaccinated? Yeah, that's a question. If that dog is vaccinated against rabies, you don't need to give that individual any prophylaxis. The person is okay. But you ask the owner, is your dog vaccinated? The person said no. Or I bought it from somebody. I don't know the vaccination status of that dog. So what we are going to do You are not going to kill the dog, please. This is a domestic animal. This is somebody's pet. So what we do is that we quarantine the dog for 10 days. So you just keep the dog in a closed, in an enclosure and observe the dog for 10 days because we expect a rabid dog or a rabid cat to develop signs and symptoms of rabies within 10 days, right? So if you quarantine the dog or the cat for 10 days and you did not see any signs and symptoms of rabies, then you can say that okay, this dog doesn't have rabies and you did not give that person prophylaxis. But if the dogs develop or the cat develops rabies signs and symptoms within that 10 days, then you need to give that person post-exposure prophylaxis. If the dog or the cat that beat that individual is not available, the dog or the cat ran away, you must give post-exposure prophylaxis for cover because you don't know the status of that dog and there's no way for you to test it. All right. So let us ignore what we have here. It is a mistake. So you don't know the vaccination status of that dog, either because the owner is not doesn't know, or the dog is not available, or the cat is not available. You quarantine for 10 days. So if the animal showed signs of rabies, right? You must give prophylaxis. So there's a mistake here, it should be interchanged. So you must give prophylaxis if there's signs of rabies. If there's no signs of rabies, the patient does not need prophylaxis. So this doesn't make sense. I mean, what they wrote here doesn't make sense. So for some of us that want to confirm, we can go outside and check other algorithms. We are going to say that this is a mistake. So animal bite, we are moving down now to wild animals. So somebody gets attacked by a bat, raccoon, or skunk, and the person presents. So we must euthanize, and test the brain of that animal for rabies. So if it's an animal that is available and we can lay our hands on the animal, so what we are going to do is we euthanize the animal, we kill it, we obtain the brain, and we do histological, evaluation of that brain for rabies, right? If the animal is negative for rabies, no prophylaxis. You can say this makes sense, it's correct, no prophylaxis. So, but if the animal is positive for rabies or the animal is not available, give the patient prophylaxis. If the animal is not available, always give prophylaxis. If the animal is negative after testing, do not give. If the animal is positive, give prophylaxis. Now, fine. We have looked at the algorithm that tells us if the patient needs prophylaxis or not. But what do we give in the prophylaxis? It depends. So the prophylaxis can either be active immunity or a passive immunity. Active immunity meaning that you are giving vaccine. Passive immunity means that you are giving the immunoglobulin, right? In some situations, you only give active immunity. In some situations, you give both active and passive immunity, right? So once you are giving prophylaxis, definitely your patient will take active immunity, which is vaccine. The only thing that might change is that, okay, the patient might not get the immunoglobulin with the vaccine, right? So, but always, they will always get the vaccine. So let's look at, you know, the situation. So if the patient is previously immunized with rabies, right? So like I say, the body they can't wait. Body is strong enough, right? So what you just do, you just give active immunity, to further rekindle the immunity. So you give vaccine only, right? But if the person is not immunized ever, the person has not been immunized against rabies before, so in that situation, you are going to give both your passive and your active, which is your vaccine plus your rabies immunoglobulin. I think that is clear. So don't forget, always ask, find out the vaccination status of that dog or the cat. If it's a wild animal, you euthanize it. If it's not available, you go ahead and give your PEP. But the PEP that you give depends on the vaccination status of that individual. Is the person previously immunized? Yes. Give only vaccine. Is the person previously immunized? No. Give vaccine.